Thank you, Dr. Abhishek, and thank you, Hindi team. Now we are moving to the next session in English. Today is our 1829th day. Before beginning the session, we'll have a silent prayer.
डॉक्टर धनेश नहीं आते पहले डॉक्टर धनेश
हम कहाँ आते हैं
ना पहले
Welcome everyone to today's session. Today is our 1829th day of continuous webinar. Thank you all the participants and faculties for joining with us and sharing your knowledge with us. And today's our guest is Dr. SHWETA SINGH. She's MD and PhD and Research Associate of Central Council of Homeopathy Headquarters in Delhi. She's a senior consultant in Orbit Clinic, 10 years of experience, and graduated from Baxton Homeopathic Medical College, PG Diploma in Health Promotion from National Institute of Health and Family Welfare, President of Delhi Homeopathic Association, Chief Administrator of KHA Homeopathy Study Group in USA, and Chief Editor of biannual newsletter Exploring Homeopathy and Associate Editor of Homeopathic Heritage. She worked as an assistant professor of Organon of Medicine, and she got many awards. One of the greatest award is the legendary homeopathic award from the Health Minister. So I am welcoming you, Dr. SHWETA Singh, to our webinar. You are most welcome to IFPH webinar and happy to see you again.
Thank you, Doctor. And it's my pleasure to be on IFPH platform once again. And I'm really thankful to Dr. M.K. Sani sir, Dr. Dhanesh for inviting me and giving me this opportunity to share my little knowledge with all of you. Let me share my screen first. Is it visible?
Yes, yes.
So today my topic of discussion is homeopathic insights into dermatological cases. Dermatology branch basically deals with skin and hairs, and being a homeopath, being a homeopath, we have a homeopathic view to all the skin diseases. And for us, skin diseases are the outward expression of what is going inside. It is the superficial layer, but the disease belong to skin does not only belong to it. It belongs to some internal dyscrasia. It is basically a reflection of internal dyscrasia or disharmony, or we can say diseased vital force. Skin, as a largest organ of the body, it serves as a mirror which reflects the condition of various internal vital organs. Skin diseases, they are not simple skin problems, but they are the result of an underlying internal disorder. Basically, what we see on the surface of skin is only a fragment of disease. The real disease is inside. The real disease belongs to the internal vital organs. And skin disease, like other diseases, it is dynamic in nature, but the difference is it appears on the surface of body. But the cause, the root cause is always inside. The root cause is always internal, is associated with the internal vital organs. So cause is always within. In homeopathy, basically local maladies means the skin, those diseases which are on the surface. The local maladies are actually not local. Disease we can say it is local because it is expressing itself outwards, but it is the outward expression of inward and spiritual vital force. For such skin diseases which are superficial to us, which appears on the surface, the homeopathic treatment is always the same like any other disease. And in homeopathy, we do a homeopathic case taking, which is a process through which we get to know our patient and their sickness as a whole in every aspect, so that we can treat our patient in a very rational and judicious way. Homeopathic case taking is basically the aim of uh, that exhaustive case taking is to individualize a patient. We have to diagnose the patient pathologically and therapeutically also. In homeopathy, we have to inquire about the pathological symptoms, but along with those signs and symptoms, we need to know about the patient's physical, mental, and social, spiritual state so that we can know the patient as a whole, and the patient with skin disease is to be treated as a whole. We do not treat patient only on the basis of their skin eruptions or the part involved or the organ involved or the system involved, but we see patient and we try to treat the patient as a whole. And we ask our patient a lot of questions related to their skin eruptions, their modalities, their aggravation factors, their amelioration factors, the associated complaints, along with that their mental state. We ask so many questions. We do exhaustive case taking to those patient. Just those symptoms, those questions seems to be very strange, very weird, unique, or sometimes interesting to our patient. That is because just to know our patient as a whole and to individualize the patient. And in such a way, individualization, basically it is necessary. We should try to individualize our patient in every skin disease. We have to differentiate one patient from another patient suffering from a same condition by some exclusive features in order to find out the homeopathic similarity. These exclusive features can be hidden in the modalities, in the mental generals, in the physical generals, or in any other sign which they are expressing. Basically, we follow this procedure, this process of individualization in every case to reach out to the similum. And the constitutional treatment or the antimiasmatic treatment is the only way for radical cure. What is cure? Radical cure, or what is cure? So it seems to be very simple. Like at first, we just say just the disappearance of the symptoms, but the disappearance of symptoms really, it is really not cure, but we have to go beyond it. Cure is the meaning of cure is much deeper from the point of view of Organon, from the point of view of Dr. Henneman. Cure means the change made by the most similar homeopathic remedy, not only eradicates a symptom with which the patient is complaining, but the effect should reach to the core of the patient, to his body's own healing energy, strengthening and balancing it. There should be, with your similar homeopathic similar remedy, there should be balance in the pathological symptoms. There should be disappearance of the pathological symptoms, but along with that, there should be strengthening of its own healing energy, the body's energy, with the balance on the mental, physical, and social, spiritual plane. So that is basically the cure. not only the specific symptom disappearance, but entire spiritual, mental, physical, emotional being is to be restored to the natural state. That is the definition of cure. So we do case taking to individualize our patient, and in aphorism 82, Dr. Henneman explains that no real cure can take place without a strict particular treatment of each case of disease. So we have to individualize each case in our OPD that is suffering from skin diseases. In aphorism 153, Dr. Henneman wrote that in search for a homeopathic specific remedy. Homeopathic specific remedy, basically, there is no specific remedy in homeopathy, but there are specific remedies for every specific individual. Those remedies are not specific to disease condition, but to the individual. We have to see the more striking, singular, uncommon, and peculiar characteristic signs and symptoms of the case of disease, which are chiefly and most solely to be kept in view. Because in every case, we usually get all the general and undefined symptoms, which are useless to us. They are important just to make pathological diagnosis, just for disease diagnosis. But for therapeutic diagnosis, we need the individual's more striking, singular, uncommon, peculiar characteristic symptoms, so that we reach out to the to find the homeopathic simillimum, which is the specific remedy to that particular case. And such striking, singular, uncommon, peculiar symptoms are always available in a curable case, but they are hidden in the minute peculiarities or minute details of your case taking. And being a homeopath, we should possess such skills and such qualities to find out those peculiar, striking, singular, uncommon symptoms in every case. That is why we do homeopathic case taking, and that is why we call homeopathic case taking as an art, not a mechanical process. So we need to find out that simillimum on the basis of those. We need to find out those striking, singular, uncommon, peculiar characteristic symptoms in each and every case. Basically, the selection of simillimum and those striking, uncommon, peculiar symptoms of an individual case makes the totality of the symptoms. We homeopaths, we do not give symptomatic treatment. That means we do not give treatment on the basis of one symptom or on the basis of that group of pathological symptoms, or on the basis of the disease diagnosis. But in homeopathy, we give symptomatological treatment. We give the medicine on the basis of totality of the symptoms. And that totality is not the quantitative totality. It should be a qualitative totality. Quality should be there. And that totality, basically, it is a aggregate of all the characteristic peculiar symptoms which are arranged in a philosophical ways, and which that totality should represent the individual picture as a whole, and that makes the totality on which we usually prescribe. In aphorism 7, Dr. Henneman wrote that now, as in a disease from which no manifest, exciting, or maintaining cause has to be removed, we need not to prescribe in each and every case. At first we should see is if there is any exciting or maintaining cause that is leading to that malady. If so, we first try to remove that exciting and maintaining cause. That improvement or that restoration will eventually occur. So at first we have to remove those exciting and maintaining cause. And if after removing those exciting or maintaining cause, if the disease persists, then it shows that there is some internal dyscrasia, that it shows that there is miasm involved. So that makes that we can perceive nothing but the morbid symptoms after removing the exciting or maintaining cause. Those symptoms are very important, and be the symptoms alone by which the disease demands and points to the remedy suited to relieve it. On the basis of those symptoms, we made the totality, which is the outwardly reflected picture of the internal essence of disease, and that is the pure affection of the vital force. Those symptoms which make that totality is to be the principle. It is the sole mean by which the disease can make known what remedy it requires. That is the only thing on the basis of which we prescribe the most appropriate remedy. So the totality of symptoms must be the principle in each case. That totality we make in the skin diseases. We can see the location of the skin eruptions. We can see the morphology of the skin eruption that individualize those skin eruptions. So we have to take care of the location. We have to see the morphology. We have to see what kind of discharges it is giving. We then, after those skin symptoms, eruptions, we should ask the patient about his or her physical characteristics, like the appetite, thirst, desire, aversion, sleeps, etc. Then also the mental and emotional characteristics is to be take care of. That will make the totality. In skin diseases, the external application, it may seem as if cure process of a local disease could be accelerated with correctly chosen homeopathic remedy internally as well externally, selected on the basis of totality of symptoms. So, but it might possible produce a more rapid improvement. If you want to do external application, do not use different remedies internally and externally. Dr. Harriman advised if there are cases in which you have to give external application, the remedy should be same. You have to prescribe the most similar remedy, homeopathic remedy, the same remedy internally as well as externally. That too, prescribed, selected on the basis of the totality of symptoms. And that in that way, it might possible it will produce more rapid improvement. But usually he said that external application should be avoided. Why? Because in aphorism 194, Dr. Henneman wrote that it is neither beneficial in acute diseases of rapid growth nor in those of long standing to use a remedy externally as a local application to the disease part, even if the medicines were specific and curative in that form. Why we should not do external application? Because it is entirely objectionable treatment. It allows premature disappearance of the local symptoms. It will give a retrograde change, means the disease, the skin eruption will turn into internal direction. And it will be difficult to assess the disease being totally exterminated. And in the cases of external application, there could be a chance that it will be a suppression or it will be a palliation. So if there is palliation, the disease will reoccur after some time. If there is suppression, the disease will grow more in in the direction of internal inner side, and it will grow more graver and it will go to more vital organs. So it should be avoided in cases of skin diseases. There are few exceptions where you can use external treatment, like only in the cases where administration of medicine is difficult by mouth. And you can give the medicine in the form of olfaction or inhalation, which is more efficacious. Now, let me share some cases to all of you. The first case you can see in the picture, it is a case of 7-year-old boy who came to me with her mother for homeopathic consultation in October 2024. And as you can see in the picture, there is a lot of scaling, and with that scaling, the patient complains me about the itching which aggravate at night and after bathing, and which is aggravated by cold air. He was on the allopathic treatment since April 2024, but it is without any relief. Associated complaints were dribbling of liver during sleep. There was pain in multiple joints, and the nails were brittle in character. Physical generals, the appetite was extreme. The patient cannot tolerate hunger. And that 7-year-old boy, he has frequent urging to urinate, and he passes urine in drops, which was yellow in color, and he has to strain for urine, and there was no pain, it was painless, but the urine was offensive in character. Thirst was extreme, and there is a lot of dryness of mouth. Desire is for sweets, indigestible things like pickle, rubber, paper. Thermals, the patient was hot in thermals, and the perspiration of the patient was increased over scalp. Stool, he passes stool 4 to 5 times in a day, and he has to rush to the closet in morning every time after eating and every time after eating. So these are the physical generals. In the mental journals, there was the patient was irritable on slightest trifles. He throws things in anger. There was fear of injection, fear of dark. The patient talks in sleep. He has a weak memory. He is forgetful, and he has aversion to bathing. So, on the basis of these physical generals, mental generals, and the skin condition, I have made this totality. Psoriasis over whole body, appetite extreme, cannot tolerate hunger, urine frequent urging in drops, offensiveness, desire sweets, indigestible things, thirst extreme with dryness of mouth, hot patient, increased sweat, moreover scalp, and you can see this makes the totality. So on the basis of that, I repertorized the case, and the first grade remedy was found to be sulfur, and the patient, because of the aversion to many of the symptoms, are basically matching with sulfur. Aversion to bathing, that toxin sleep, forgetful weak memory, then other symptoms, urinary symptoms, and all, hot patient, desire for sweets, all, to pointing out to the remedy as sulfur. So I prescribed sulfur 30 one dose to him, followed by Saclec 30 TDS. And but in the follow-up, there was no relief in anything. In fact, the itching and scaling increased. So I reanalyzed this case, and some few more symptoms I got in this case. That is, one is blocked nose, which aggravate at night. And one of my observation was there was a fan-like motion of his LNSI. The patient was very headstrong. There was very much anger in him, and which aggravated by contradiction. He is like very dominating towards his parents, but he is very shy and timid in front of me. So in front of others, he was usually shy and timid, but at home, to his parents, towards his parents, he was very dominant. So if you see the repertorization chart, the second remedy, lycopodium, was more matching to his totality. So on the next prescription was lycopodium 200, one dose followed by Saclec 30 TDS thrice in a day, and I take the follow up after 20 days. And in the next follow up, the itching was relieved a little and scaling was little bit increased, but the stools reduced to 2 to 3 times a day, and urinary complaints were also little better. So in the next follow-up, I go towards the higher potency of lycopodium 1M. I prescribed lycopodium 1M, one dose to him, followed by Saclec 30. And in the subsequent few months, I think 1 or 2 months, you can see the result. This is the result with lycopodium 1M, followed by Saclec 30 TDS. So it is not necessary that many a times we fail with our first prescription. So don't lose hope and just reanalyze your case, retake your case. There are it can take 1 sitting, 2 sitting, or 3 sitting to know your patient in a more better way. And these characteristic symptoms can be anything. It can be your observation. It can be something the patient take usual, but it is important to you. So just stick to that and just observe in every sitting. There may be failures, but you should try your best in every case. Now the next case, it is a case of wart in a tall middle-aged male patient who came to me with a complaint of wart. The location was over his left thigh. There is single wart on the left thigh, which is large and painful in character. Associated symptoms were the patient usually complains of aching pain in extremities, which was persistent since long. He coming to me uh, and for his these pains, and which aggravated by rest and ameliorated by motion. He took painkillers on and off for those pains of extremities. And in homeopathic treatment, I gave Rustox, which gave him little relief, but the treatment was not continued, and the pains were recurrent in nature. In the personal history and journal history, the patient was very addictive to tobacco, and there was aversion to tea. This is the only history I got in this case. I repertorized the case on the basis of these few symptoms. Like I took wart large, painful in the lower limbs, tobacco desires, and aversion to tea. And I came up to Thuja as a first grade remedy, as the top remedy in repertorization. Then I consulted Materia Medica, and I got these indications. Like Thuja is a antipsychotic remedy, we all know. It is principally a left-sided remedy. There's one more thing which I got in Thuja is aching pains that increases so long as he keeps still, and he's compelled to keep the bed and then constantly moves and turns like Rustox. The pains aggravated by rest, but he has the pain compelled the patient to constantly moves and turn. So better by motion. And one more symptom was there, that is such symptom would be cured by Rustox when the case is not psychotic, but when these symptoms come from suppressed gonorrhea, Meadow or Thuja will cure. It is written in Kent. So with this symptom, I prescribed him Thuja 200, 1 dose, followed by Saclac 30. And you can listen to this patient.
राधे राधे।
Sorry, it is in Hindi.
मेरा नाम घनश्याम है। मेरे जांघों के बीच के अंदर एक मस्सा हुआ था जो मुझे बहुत परेशान कर रहा था। तो मैंने डॉक्टर श्वेता से दवाई ली। दवाई लेने के 6 या 7 दिन बाद वो अपने आप ही टूट के गिर गया। अब मुझे आराम है, किसी प्रकार की कोई दिक्कत नहीं है।
So he is basically saying after Thuja 200, his wart basically breaks down and it disappears in 6 to 7 days only. So this is the magic of homeopathy. With a single days, we can cure such one-sided disease. Only one symptom was there, and you have to dig out the other characteristic or peculiar symptoms to make that totality. And if you work in that way, then definitely you win with the homeopathic remedy with a single dose. Now, the third case, there is a case of papilloma breast, a female patient who is a housewife. She aged 30 years and she is overweight lady. She presented with an outgrowth on her left breast. So this is the wart, that papilloma that is on her left breast. The location was left breast areola. And if you can see the picture, it is a wart-like growth filled with fluid. It is a pea-sized hanging with a stalk, pedunculated wart, you can say. And the sensation was, it is tender and it is painful to the patient. After analyzing the case, after repertorization, I repertorized the case in the large, pedunculated, painful, soft wart. These are the remedies which comes up in this case. And there is one peculiarity in that patient is she was markedly anxious about her health. She was keep coming to me to check for lump in breast for the past 2 years. She was very anxious about it because her friend has breast cancer. So she had that feeling that I might get that breast cancer. So she keep coming to me in every 15 or in every monthly or 2 month basis and asking me to please write mammography for me, please take my breast if there is some lump. But there was nothing. It was every time it was found to be normal. This is the condition a year back when but the anxiety in her, it remains the same. Then one day she came to me with this wart. So on repertorization, these are the remedies which are coming up, and in every rubric you can see these are the remedies. And I took this anxiety health about one more rubric from her mental plane. And in this, nitric acid was the remedies which are similar, which are same in every rubric. Nitric acid covering all the rubrics. So in this case, I prescribed nitric acid 30. I repertorized the case. Nitric acid was the top remedy which is coming. And I prescribed nitric acid 30 to her, 30C. And you can see the disease. Day 1, day 3, it shrinked. Day 7 and day 15, it usually disappeared after nitric acid 30, 1 dose, followed by Saclac 30. There's one more case of psoriasis. This is a male patient aged 52 years who came to me in March 2021 with a complaint of severely dry, you can see in the picture, severely dry, cracked skin of both hands and soles. He was suffering from it since 1 year. He was using allopathic ointment, soframycin on and off without any relief. Basically, it vanished off, then it again recur. So this was the condition. There is a lot of itching and the patient had tendency to pick the skin constantly. Along with that, in the physical generals, the patient had strong desire for sweets and he has an aversion to tea. Tongue was found to be coated white. in color, and thermally the patient was hot. Snoring was also present. Mental generals, the patient was irritable, he was lazy, talkative, very much talkative, and the patient had an aversion to being washed. You can see the condition of his legs, soles. He don't even you can see the condition, you want to wash normally, but he don't want to wash his legs or his soles. So he has an aversion to being washed. Now the totality, there is dirty, filthy looking skin. There is aversion to being washed. There is itching with pricking of skin. Desire for sweets was there. And there was itching suppressed with use of ointments. On the basis of these symptoms, I repertorized the case. Sulfur is the topmost remedy which is coming out, and I gave sulfur 30 thrice a day for 3 days, and you can see the results. This is the result with sulfur 30 in this case. The next case, this is a case of Meibomian cyst. Meibomian cyst is basically the recurrent, there are notes you can see, chalazion. And he's a patient, male patient of 38 years old who is tall, fair. He came to me in January 2020 for these painless, hard nodular swellings, bilaterally present on upper and lower eyelids since 1 year. The case, complaint was recurrent in nature, and the patient has also undergone surgery multiple times, but it is very recurrent. He, in the past history, there was history of left-sided renal stones for which he took homeopathic treatment in the past. And blood sugar levels, I asked him to check, and it was found to be within normal limits. In the physical and mental journals, there was nothing peculiar, and however, the patient was little, irritable, and every little thing offend him. He is quarrelsome. He likes to travel across different places very much. The totality was painless, hard nodular swelling, bilaterally present on upper and lower eyelids. It is very much recurrent in nature, and quarrelsome patient desire to travel. This is basically the repertorization, and staph is coming to be the most wanted remedy in the cases of recurrent styes or chalazion, and I prescribed Staphysaceae 200 single dose followed by Rubramid 30. In this case, this case took me a lot of time to treat this patient, and I went to staff to till 10M potency, staff 10M I have given, and then you can see the result with Staphysaceae. In such cases, homeopathy is so much, in demand, because in cases of Meibomian cyst or chalazion, in the modern medicine, there is only corticosteroids or injections, or they can only do incision or curettage, which has permanent, which can permanently damage the Meibomian glands, which can lead to complications like dry eyes or ocular irritations. But homeopathy, it is very safe for such kind of diseases, and it usually gives a lot of good results in such cases. The next case, this is a case of atopic dermatitis, and this is a 5 to 6 months old baby presented with this condition. It's a case of January 2020, and you only on looking out towards the skin, we can see there are moist skin eruptions. There is copious serous exudation, thick leather-like crust under which thick and white pus collects here and there. Hair is glued and matted together. It has very offensive odor, and these eruptions came up after vaccination. So this totality and only on looking out towards the skin, you can reach to your simillimum if you are LN prescriber. So you can definitely very quickly jump to the remedy, that is Miserium. I gave Miserium in this case, single dose, and you can see the result. Just in 1 week, all the skin eruption cleared up with Miserium 30. The next case, this is a case of granuloma annular actinic. Basically, granuloma annular actinic, this is a case of 62 years old lady. She came to me in Feb 2024 and for her skin issues, diagnosed by a dermatologist as granuloma annular actinic. This is a skin condition which is characterized by annular plaque, or there are papular eruptions on the sun exposed area, and especially affecting the middle-aged adults. It is a form of granulomatous dermatosis where skin immune system react to sun, and it basically damaged the elastic tissues. And in modern medicine, there is no specific treatment. They only have the topical, the intralesional corticosteroids, or they can only give you laser therapy. So this is the only thing they have. So she consulted me for homeopathic treatment, and there were eruptions, you can see, over the exposed areas of her skin without any sensation. There was little redness which aggravate by sunlight, or the burning which aggravate by when she goes in the exposure of sun, or in the exposure of heat near stove or after exercise. And these eruptions are more aggravated during summers. She has a past history of amoebic liver abscess, for which she operated in December 2023, and she is a patient of beta thalassemia minor. In the physical generals, the thirst was normal, there was dryness of mouth, and there was desire for salty and spicy things. Stool was satisfactory, but she has to go to the closet for 3 to 4 times in a day. Thermals were hot patient. In the mental generals, she likes music. She's claustrophobic, and she has a fear of narrow places or the dark places. With these symptoms, I made the totality as eruptions over skin, aggravation in summers. There was burning, aggravation in sunlight, heat, desire for salty, spicy things, thermals, hot patient. There was fear of narrow places and dark places, and she likes music. I repertorized the case, and these are the remedies which came up. And as the condition was aggravated during summers, she can't bear the heat of the sun, and there is desire for spices. Hot patient, she was a hot patient, likes music. So I go with the first grade remedy, natramute. In this case, I prescribed natramute 200, 1 dose to her, followed by sacrum lactis 30 TTS. In the follow-up, the eruptions were little better. So I repeated the remedy in higher potency. But in the higher potency, I didn't get the desired results. So on further case taking, on re-evaluation of the case, my observation was I asked her to show her tongue, and it was coated thickly white in color. So on the basis of this coated thickly white coated tongue, all the condition aggravated by heat, cannot bear the heat of sun. So all the symptoms are pointing towards a remedy, that is entim crude. And the true guiding symptom was this, the coated thickly white tongue. So I prescribed her entim crude 30 BD for next 15 days, and in a couple of months you can see the result with entim crude 30. She can better enjoying the sunlight exposure, and there was no recurrence to those eruptions, and there was no burning, itching or anything in the skin with antim crude 30. So this is one more case where we learned that we have to, we should go by the observation. We in every follow-up, in every sitting with the patient, we should try to get more and more symptoms, that is more characteristics that is more uncommon, peculiar to that patient's condition, and which can help you to find out the best remedy for the best individual, the most similar remedy for that individual or for that patient or for that skin condition. So with this, I'll just rest my case, and thank you so much for your patience listening.
Thank you, Dr. Shweta. As usual, so it was an excellent presentation. The way you are taking the class impressed me always.
Thank you.
And the participants, if you have any questions, please raise your hands and ask question to Dr. Shweta. I think all of your cases you presented here is you got cure within short period. I think most of the cases it won't take more time.
No, that Chelizion cases or that Meibomian cyst case, it took me around a year to break down
Yeah,
that
even though
recurrency actually. It's not like we got result in a very short span, but we have to break down that recurrency of the disease, and usually it takes time. So in that case, it's like the Chelizion got the frequency reduced, but recurrency was there, and we continued that treatment for 1 year at least. It takes me 1 year. Now the patient is free of that nodules.
no other cases that you have shown, the other cases, no, that you got the quick result. Normally the skin diseases will take more time to cure, no?
Yeah, there are some, there are very much obstinate cases. We took a lot of time. We have to reanalyze the case. We have to find out what is basically lingering in that case, what we are not getting. Sometimes the patient is unable to disclose those minute peculiarities. Sometimes we are unable to get out of those peculiarities. So it is, two-way. We have to work
Yeah.
together in these cases.
Many of the patients, they don't even realize that is the cause behind the disease. Even
Yes.
they even don't know the cause of the disease. After many consultation and all,
They
only
open up. Yes,
yeah,
you're right.
it's also one of the reason. But even though you're sharply observing your patients and getting the medicines, appreciate you.
Thank you so much.
And Dr. Raman Dhawan was is asking, generally you use single dose? The question to you.
Yes, sir. In most of the cases, I use single dose, but there are some cases which I showed here. I use frequent doses also. Like I have given doses in thrice a day or twice a day also. But it depends. It is actually experience. But usually in constitutional treatment, I prescribe that single doses. Where you get the mental symptoms, the peculiar mental symptom, if you get, you should try that middle 200 potency or higher potency.
Thank you. I think the same Dr. Dr. Raman Dhawan is asking, will you increase the potency?
If I do not get the desired result, then I increase the potency. Like in the last case, I have shown that I prescribed the patient Natramune 200. There was little relief, so that was Natramune 200 single dose. I followed up after 20 days. So after 20 days, if I do not see the desired result, then I definitely, if it works, then I usually give higher potency in that case.
Dr. Masrina is raising hand. Dr. Masrina, you can ask, please.
Okay, thank you, Dr. SHWETA. Okay, I have one question. This is pertaining to your experience in giving sulfur and probably 30 or 200 potency, and whether in your experience it has caused any severe aggravation to the patient in skin diseases. Could you share if you have such experience, and how do you manage that?
Usually in 200 potency, I haven't prescribed in frequent doses. I usually give single dose in 200, and I didn't see, I have been practicing since 10, more than 10 years it is, and I haven't seen any aggravation. There was one case where I saw aggravation, but it was the previous symptom of the patient. According to the patient, it was aggravation, but to me, it is going towards a right direction, because it was a previous symptom. It was the patient had that symptom in the past. So that's all I could remember, and I haven't seen any aggravation.
Thank you.
And one more thing, in my practice, I basically in 200 potency, I give water dose. I ask the patient to dissolve that one dose in 1 glass of water or 1 liter of water, and I ask the patient to take it, consume it in a whole day.
All
So
right.
it will be a
Okay.
divided doses phenomena, and I think it helped me to not get aggravations with high potencies, maybe.
Thank you, Doctor. Thank you, Doctor. Thank you so much.
Thank you, Dr. Masrina. And usually everyone is afraid of sulfur.
I use sulfur 30 thrice a day in some of cases, and it gave me result. I don't know.
Dr. Danish has raised hand. Before that, I would like to ask you, do you have any prickly heat cases?
Yes, in the prickly heat cases, I prescribed that cesium. Cesium 30, it works very good in those cases. Cesium 30.
Thank you. Dr. Danish, you can ask.
Yes, Dr. SHWETA Singh, it's really excellent session. And the cases were brilliant, and your case taking as well as your medicine selection as
you.
well as the potency are really fantastic. That's the reason why you are getting results with single potency. And as you rightly point out here, I am in the early part of my career. Most of the people used to come with a bottle where and that's some 35 years ago or 38 years ago back. Usually people come with the big bottles, and so what we do is just give some sterilized water inside and put the 1 drop of the medicine and ask them to take every 1 hourly, 2 hourly in acute diseases. But the results were excellent in those days. But the things were gradually changed, and people, we just went up with the pills and powders and even biochemic tablets. Then things are different. Because the quality of treatment become different, and the quantity of income also become different. Because in
Absolutely
the
correct.
early part of my career, I used to give medicine for rupees 3, 4 rupees was the my first consultation fees, including medicine. in those days. But in those days, I may get to some 20 to 30 or 40 cases a day. In those days, that for 4 rupees, we can buy a lot of things. But things are entirely different in those days in compare with these days. But the results are also quite fun. In those days, the mathematical reading was very less. So, but still, we are getting result. That's what I would like to add to this session.
In the beginning
Actually,
of my practice, sir, I am afraid to take skin cases because I failed many a times. I failed. I don't know. In the beginning, I am not able to know. I don't know what was going wrong, but every case got like aggravated, or it was not. If I give single dose, then only I failed. If I prescribed in thrice a day or frequent doses, then also I failed. I don't know, but with time, I start observing, and I make those totality. See, the totality, the physical, mental, everything is important. And if you got that three-legged stool of those legs, na, then I think it works.
exactly. In those days, we used to give even sulfur in that way, but it
Yes.
works. But
Yes.
very rarely aggravation comes out. That's what my observation. That's why in those days I used to say that there's nothing called aggravation.
Right.
Yeah, even I have tried graphitis in that way, but there was no much aggravation. But instead, the patient get relief. That
Because
means that if your remedy selection is the right one, it will work. People
yes.
believe that if when you give a powder dose, that is the single dose. But it does not mean that a dose can be a single dose in different categories, depending upon the situation. And the frequency of repetition also can be dependent. In acute disease, you can give every 10 minutes, 15 minutes, 20 minutes, half an hour, 1 hour, 2 hourly, and like that. But in chronic disease, you just wait. Then the result will automatically come. That's the basic difference what I have observed all through my practice. Definitely, you young dynamic doctors can definitely build homeopathy to take the next level. That is, as we used to say that homeopathy is the second largest practice system, but we need to achieve the target of number one. Yes, that's the purpose of the International Forum for Promoting Homeopathy. That's why we are calling all of you to come over here and deliver lectures and present cases so that more and more people will aware about all these things.
Right.
Thank you.
Thank you, Dr. Danesh. Because of our webinar, many doctors are confident to treat uh, with the homeopathic medicine because they are seeing the success stories of all of you. Thank you so much for coming. Now we are ending up the English session. We are moving to the Malayalam session. Thank you, Dr. Shweta. As usual, your presentation was excellent. I love your presentation once again.
Thank you
Thank
so
you
much.
so much. Come again. And I think Dr. Ram Parvesha sir is appreciating you, and he's
Thank you, sir.
only one
Thank you, Dr. Rajni and Dr. Dhanesh. Everyone, namaskar and congratulations. Dr. SHWETA Singh, very nice presentation.
Thank you.
Dermatology case and skin disease case, psoriasis, lot of number of case presentation. Very nice, excellent session. Skin disease treat doctor patients and patient be patients. It's a very good treat. Doctor patients and patient be patient.
Dr.
So
Rajini,
thank
there
you,
is
very thanks. Whole team,
Thank you.
behalf of whole team,
Thank you, all
IFPH.
of you. Now we
there-
are celebrating our 5th year on the next month. I think all of you have heard about that. Dr. Danish,
Yes, IFBH is celebrating its 5th anniversary on 28th September. So there's a registration fee of 3,000 per head because it is being conducted at Taj Vivenda, Cochin. It is one of the 5-star hotel in the heart of Kochi. So please register for the same so that we can meet one-to-one. There will be some discussion. There will be some short presentations, and particularly on agro homeopathy, dental homeopathy, veterinary homeopathy, and all those things. And there is an interactive session for students with the senior doctors. So hope all of you will join us, and thank you. And tomorrow we will have a session from Dr. Dhanavishmi Mallan, and she will be talking about management of breast diseases with homeopathy. Thank you, Dr. Rajini.
thank you. I'm inviting Dr. Mariamma for moderating Malayalam session. Dr. Mariamma, you're welcome.